Good afternoon, friends, family, and especially our guests of honor, the class of 2020. It is my great pleasure to welcome each of you to this memorable occasion, although a little unconventional compared to our typical graduation ceremony, as you know. First, I want to congratulate you and your accomplishment and the success of making it here today as new physicians. It has been an incredible journey for each of you, full of challenges, but far more successes than the challenges that you've had to go through. Over the last couple of months, your perseverance has really defined you as a class, and I am beyond impressed. None of us could have predicted exactly how this global pandemic would impact our lives, especially those of you with such significant milestones as match day, classes, and now graduation. Those of us here on stage vividly recall our graduations, and nothing we experience can compare to this current situation. So today, we are celebrating you in a little different way, but we hope that each of you understand the impact of your monumental success and the impact you will continue to have in the future. Today marks the beginning of a new journey and a well-deserved privilege to change the landscape of healthcare and improve the wellness of patients and new physicians. During your medical school training, you likely heard reference to the passion to serve, the perseverance to pursue a challenging career in medicine, and the professionalism required to perform the tasks required of a physician. And you've probably also heard of the word purpose. The purpose as our future physician leaders, the purpose to change lives, the purpose to save lives. Today, you have reached the culmination of one phase of this journey, and you are one step closer to achieving the ultimate purpose you sought out to achieve just 4 years ago. Class of 2020, you were the first class when I became dean here at the University of Kentucky, so we've grown together through the many challenges and many successes. You've helped us get through an amazing accreditation process or reaccreditation process for the College of Medicine and growth in our educational curriculum, as well as our research activity, as you so well know. I am so proud of the physicians you have become, and I thank you for allowing me and the University of Kentucky College of Medicine to be a part of your journey. Before I turn the podium over, I want to give you one final tip, TIP, to take with you on your journey as you go forward. You all know well that in medicine, we look at the evidence, we look at the truth, when we make decisions on the best standard of care for a particular patient. As you make decisions based on the evidence or the truth, you want to always take the high moral ground making decisions with the right motives or integrity, or I. And finally, you always need to remind yourselves the purpose of which you came to medical school to become a physician, to help those in need and improve the well-being of our community. Please always reflect on this tip, TIP, in terms of the truth that we all look for, great integrity in making decisions, and the purpose that you actually came here on this part of your journey. Without further ado, I would like to invite Dr. Mark Newman, our Executive Vice President for Health Affairs, to deliver remarks on behalf of UK and UK Healthcare. Dr. Newman.
Thanks very much, Dr. DePaula. For UK Healthcare and for the leadership of the University of Kentucky, I just want to say congratulations to the class of 2020. Also to the parents and families, I realize how stressful this has been for you. I have a daughter in the middle of her medical education and understand the uncertainty and stress that you've gone through. Over the last number of years, I usually start, to Bob's point from before, by talking about sitting in the same seats as you. And of course, I can't see you now, so I don't know exactly where you're sitting, but I mean in the same way in talking about finishing your medical education. However, I don't think I can really say that this year. COVID has changed things in a way that we would never have thought possible in the future. It has changed your medical school experience, going more virtual, more distanced, more uncertain and scary. While there is always uncertainty in these kind of times and in these kind of transitions, this is truly unprecedented. We are restarting a new normal, and I'm extremely proud of what you have done. However, like all the other challenges that you have faced and that medicine has faced in the past, it is not really the challenge, but how we respond. It is that opportunity that sometimes allows us to innovate and to push forward in ways that we never thought we would have otherwise. It's scary to think of it, but it's an opportunity for us to continue to push this forward. The point that I want to make as we go forward is this is about how you respond. This is about your challenge. You will define the new normal in medicine. I am proud when we talk about response of how UK healthcare has responded. I am proud of how you have responded. And then most importantly, I want you to think about how you define your new normal, how you drive forward in making the best you and the best physician that you can to make a difference. I want to end, and I'm going to apologize to a few of the faculty because they may have heard this story before, but I end with a story that my father told me when I was graduating from high school. And you may ask, why do I reach back that far to find a story? But it's the last time that my father was with me for a graduation or event, and so it carries that much more importance to me. And he took credit for a story that now I've heard has been told for hundreds and hundreds of years, but that's okay. He told a story, and again, one that's been told a lot, about a philosophy professor. Again, they came into the classroom with a big gallon jar and initially started filling it up with big rocks. And you'll know the story as it goes through, but my dad picked a few different points for it. So he filled it up with these big rocks and asked the students if it was full. And they said, yes, it was full. So then he got out a box of gravel and gradually started putting gravel into the big jar and filled it up. And so they were somewhat more skeptical the second time when he asked if it was full, but they eventually agreed it was full. And so third, he got out a box of sand, put the sand in there, again, filled it all the way up, pushed it across the top. And now again, they were even more skeptical, but finally they agreed that it was full. And lastly, he reached down and got a beer and pulled the beer in, and without a drop coming down. My dad told me there was 3 really important points to the story. First one was, if you didn't put the big rocks in to start, and that's how all these people, if we didn't prioritize the big rocks, family, again, our partner, our wife, our children, we wouldn't have time. We wouldn't be able to get those in. Secondly, you're the one putting in the stones, whether they're big stones or little stones. You're the ones driving and defining what you're going to do. And I think for me, as you look forward, you're the ones defining. You're the ones that make the difference for you and for those people around you. And lastly, the potentially spin that my dad put on it, his point was there's always room for one more beer. I think as we think about it, I want you to celebrate this. Even with all the uncertainty ahead, celebrate and take the time to enjoy. Enjoy with your family, even if it's at a distance. Kentucky is proud of you. I'm proud of you, and Kentucky needs you. Thank you.
Thank you, Dr. Newman. And for those of you at home, I guess you do have a potential of beer. We don't have any right here at the moment, but we appreciate those comments. Now to deliver the keynote address, I welcome Dr. Chipper Griffith. He has been, as you know, throughout these years and even before I arrived here at UK, our Vice Dean for Education, to share some impactful words and gratitude. Dr. Griffith.
So I want to say congratulations as well to the class of 2020. This is the day that you will be conferred the degree of Doctor of Medicine. It's a great day indeed. And you know, you all came from so many different walks of life to get here, so many different paths, so many different journeys. But I tell you, each and every one of you had something in common, and that was at some point in your life, you had this dream of becoming a doctor. And today, the dream comes true. So I was thinking about what to say to you all virtually here, a little bit unorthodox. I want to talk about a movie that has to do with dreams. The movie is called Field of Dreams. Now, it's a movie from the late 80s. Your parents and grandparents, I think, have all seen it. It was one of the great movies of that time period. You all may not have seen it as students, but you need to see it. Rent it, stream it, buy it, do something before you start residency and get too busy. It is a great movie. It's magical, it's quirky, it's funny, it's moving. It's about what matters in this world. The premise for Field of Dreams is kind of hokey, but again, it works somehow. The premise is this. Kevin Costner plays a farmer in Iowa, and he starts hearing voices, and the voices say, if you build it, he will come. If you build it, he will come. And he's led to believe that what he needs to build is this baseball stadium, a major league sized baseball stadium in the middle of the cornfields of Iowa. And he does it, has lights, has everything. And that's what he builds. And then even more magically, out of the cornfields in the outfield, all of a sudden these baseball players suddenly appear. And they're baseball players from 70 years earlier. They're long since dead, but they're allowed to play again on this Field of Dreams. And so Kevin Costner and his family, they watch the Field of Dreams. They watch these baseball players every night, and it's magical. And then Kevin Costner's led to believe further that there's some living people that can enter the Field of Dreams. So he's led to go talk to the town doctor. His name's Doc Graham, played by Burt Lancaster in all of his glory back then. And Doc Graham's been the town family doctor for years. He makes all the house calls. He is wonderful. He's been the town doctor for decades. But when Doc Graham was young, he had this dream of playing Major League Baseball, and he almost achieved it. He played minor league for a few years, and then he got called up to the major leagues towards the end of the season. He was on the team. He didn't get into a game. In the last game of the season, he got in and went out to right field just for an inning. He got to play a little bit. And then he was going to get to bat the next inning, but then the game ended. He never got to bat. And he always wanted to have that one time where he batted against a major league pitcher. That was his dream. But after that season, he realized, I'm not going to be a star baseball player. I went to medical school and became a doctor. But he always had that sort of regret that he came that close to having his dream and didn't achieve it. So what happens is they're led to believe that Doc Graham can go into the Field of Dreams. And so he crosses the first base line, and he's transformed into his younger self. His younger baseball playing self, and he's got the baseball uniform on and everything. And he's out there playing now with major league players in the Field of Dreams. He's about to live his dream. It's wonderful. So he's out there, he plays out in the field, he's about to come to bat. So Kevin Costner and his family are watching the game, and then all of a sudden, his daughter goes to the ground, and she's choking, and she's dying right in front of everybody. She's choking on a hot dog. So Doc Graham's about to bat. He looks across the field. He starts running. He gets to the line, the first base line, and he'd been told that living people that go into the Field of Dreams, you can go in once, but once you leave, you can never go back. He pauses just for a second, throws his glove down, runs to save the child, turns back into his 80-year-old self. Kevin Costner says, Doc, thank you, but you were so close to achieving your dream. You were out there for 5 minutes as a baseball player. You almost got to have your dream of batting against a major league pitcher in a game. Doc, this is tragic to be this close to your dream and not achieve it. And Doc Graham says, no, son. The tragedy would have been if I was only a doctor for 5 minutes. There's lots of tragedies in this world. Coronavirus, Dr. Newman mentioned, Dr. DePaula, you're all aware of that, all the tragedies, the economic tragedies. But no tragedy, no virus can stop this dream of yours from happening right here, right now. It is happening here in this field of dreams. Nothing can stop this. So I wanted to remind you, this has been the dream for so many of y'all for years. Some of you started even very young, elementary school. But you all focused, you all knew you had to work hard and study hard and go through all these obstacles to get where you are today. You had to be serious students all through high school and do well in your ACTs and your SATs, and all through college you had to focus on things. Your friends were going to Thirsty Thursdays or something. You couldn't go. You had to study. And your true friends respected that. You had to take the biology and the chemistry and organic chemistry and worry about the MCAT and all the pre-med things. Then you got into med school, and you heard that great day where you were accepted into medical school. And medical school was hard, as you all know, and you worked really, really hard through all the foundational sciences, and then the clinical years were wonderful. You had to worry about the step 1s and step 2 exams. All those things you've had to hurdle and focus so hard and study so hard, and you've gone hurdle by hurdle by hurdle, obstacle by obstacle, and now you've achieved it, and now you're here today, doctors of medicine. Yay, me. Yay, me. And we are celebrating you today. We are saying yay, you. But when we say that, if we've trained you well, and we have trained you well, you feel kind of ambivalent about that. Because you know it's not all about you. You have chosen a profession that's not a me-centered profession. It is an other-centered profession. Your talents, your abilities, all the things that you have are to serve your fellow human beings, to serve the suffering. So it's not all about you. It's about your talents and abilities that you're going to use to help others. So yay you, but yay the world that you're going to serve. I want to say a couple things to give you warnings, though. You all have seen some doctors, some residents, some attending, some practicing physicians that don't come across as other-centered, unfortunately. And that's not the doctor you all wanted to be. This was not your dream. You wanted to be the other-centered physician, but you've seen doctors that are me-centered. And how can you resist devolving into that type of a physician? So sometimes it happens even in residency. Residency's hard. For parents, families out there, we have to limit the hours of work a week to 80 hours a week. Imagine that, because they work more than that. It is a really hard job, hour after hour after hour. You're working, you get very well trained, but it's hard. And what happens sometimes in residency, you start saying, I'm so tired, I'm working so hard. You start feeling sorry for yourself. You start saying, gosh, I work harder than anybody, and I deserve more respect, I deserve this, and that, me. If you start feeling that way, stop. And think about this. As you're going into work in the morning, maybe it's 5 a.m., 6 a.m., you're going in really, really early to work, stop and look around you. You think you're working harder than anybody? There's other people there. You'll see the custodians there, bright and early in the morning, making your health systems cleaner. And just an aside, some of the true heroes of this COVID have been the custodians keeping our hospitals clean. There's cafeteria workers helping prepare food for families and patients that are in distress, trying to make the hospital a better place for everybody. They're working just as hard as you are. You may think, oh, well, I work 80 hours. Well, I'll tell you what, a lot of them work 2 jobs. They work just as hard as you are, and they're never going to make the salary that you're going to make. So sure, you work hard, but others do as well. It's not all about you. It's about others. Second, when you start thinking, oh, it's all about me, all of my talents, I deserve all these riches, fame, and glory of being a doctor and all this, just realize and stop and remind yourself that none of you did this alone. None of you did this alone. Whether you won the genetic lottery, but more likely you were helped along the way. We were all helped along the way. We were all supported along the way. One of the saints of America was Mr. Rogers. Mr. Rogers said, "Someone along the way has smiled you into smiling. Someone's loved you into loving. Someone's believed you into believing." So at this point, out there in this virtual world, close your eyes. Close your eyes. And think about those people who supported you, who believed in you, who made today possible. And thank them in your heart. For some, it's your parents, your siblings, your spouses, significant others, the great friends of your life. You supported each other. It made today happen. A beloved grandparent, a teacher. Thank them in your heart. This day is just as much about their support and their belief in you as it's about you. And thank them. And the final thing I want to tell you about is as you go into practice, don't abandon and don't forget the great teachers of your life. Don't forget the great clinical teachers of your life. You may say, who are your great clinical teachers of your life? Well, you've had some great clinical teachers. You've had Dr. Feddock, you've had Dr. Holine, Dr. Lee, you've had Dr. Moorhead. There are some great clinical teachers, but they're not the great teachers of your life. Who did you learn what a heart murmur sounds like from? Who did you learn what the crackles of pneumonia sound like? Who did you learn how to listen to someone in distress? It was the patients. The patients have been and always will be the great teachers of your life. And don't abandon them. And you may ask yourself, I'm not going to forget them. How is it going to happen? Well, why did those folks allow you to learn on them in the first place? You weren't a doctor. Why did they let you listen to them? Why did they open up to you? You weren't a doctor. Well, there's lots of reasons that patients do that. Some of the reasons are, I think patients have just a general sense that the care they're getting at academic medical centers is really good. There's lots of studies. They don't know the literature probably. There's literature that care in academic medical centers, the outcomes are better than equivalently sized hospitals in complexity. And why would that be so? Well, there's lots of reasons. One reason, though, I think, is the multiple eyes taking care of the patient. Things don't fall through the cracks because people are looking. You got students, you got residents, you got faculty. You got multiple minds thinking about the problem. You all contributed to diagnosis of the year. You all made suggestions that no one had thought of and made a difference in the care of the patients. So you all have contributed. I think the patients understand that. Second, I think it gives many patients meaning. They've got heart failure or something like that, perhaps, and to allow that it can't be reversed, but they can let this young doctor-to-be learn what heart failure is like. And then they do that. It gives them meaning. And finally, you all often knew them better than anyone on the team. The team would finish rounding, and you all could go back and spend time with them, keep them company during the anxiety of their hospitalizations. So these were the great teachers of your life. And they said, this is my body, broken, on which you may learn. Just don't forget me. So you may think, well, how would I forget them? I'm not going to forget these patients. Well, what happens to you as you go back into practice, you start thinking, I've delayed gratification for so long, and I deserve the big house, I deserve the big car and the fancy vacations. Me. And you will become very aware that if you take care of patients with this type of insurance, you're going to get more money than if you take care of patients with this type of insurance or no insurance. And you're going to say, I deserve this stuff. I've worked so hard. I'll take care of these patients. Somebody else can do the rest. And you're abandoning the great teachers of your life because a lot of these patients, academic medical centers are referral centers and to get the highest, most complex care. But also we're all the safety net hospitals for our states and for our cities. And patients come here that have those types of insurance, and we take care of them. If you abandon those folks that helped you learn, you're abandoning the great teachers of your life. Don't do that. Don't do it. So I want to leave you finally with one more quote from a movie. It's the movie Spider-Man, the original movie, the Tobey Maguire one. In that one they say, with great power comes great responsibility. And you all have great powers. You were the pride of your families. You were the glories of your hometown. But with that power comes the responsibility. And the responsibility is to be nothing less than the best physician your amazing abilities allow you to be, not just today, every day, every day, every day of your life. That's your responsibility. The patients expect nothing less than that. They deserve nothing less than that. Finally, when does this end? When do you stop being a doctor? Today's your first day of being a doctor. When does it end? Well, I'm going to tell you the story. I told you the first day of medical school. Some of you may remember this, some of you may not, but it bears repeating. I'm going to tell you the story of the best doctor I know, and that's my father. My father is a pediatrician in the small town of Alabama where I grew up, and he was the best doctor. He raised generations of children in my small town. And he was somebody who would see 60 or 70 or 80 patients a day. It was amazing how many patients he would see. And it wasn't just because he wasn't trying to make more money. He was trying to, because the need was there. He would work on Sunday afternoons, Saturday afternoons. He would meet his patients in the emergency room because he needed to be there when they were sick, not a stranger. And how did he see so many patients? Well, one way, he never even needed a chart. He knew the patient so well, he didn't even look at a chart. It was incredible. But also, he would walk into a room. My dad was a big guy. He's about 6'4". And if it was a baby or a small child, he'd pick them up, and he started examining them. And he talked to the parent just as he examined them, and they would play with his face, and they just loved him. And so it was only a 5 or 10 minute encounter, but they spent 10 minutes in the arms of my father. So my father, for health reasons, had to retire, but he hasn't really retired. He goes on medical missions all the time. He goes all around the world, India and South America. I've gone with him on several missions to Tanzania and Belarus. I'll never forget, though, one time we were coming back from Tanzania. We were on the airplane and about to leave, and I heard something that I've heard many times. Is there a doctor on the plane? I travel quite a bit. I've heard that. I've probably gone to about 20 patient emergencies. Most of the time, it's pretty straightforward. Somebody fainted, perhaps. Occasionally, somebody's had a seizure, but it stops. They're stable. I've had some pretty serious things. I had a GI bleed one time. But the answer is always, here I am. So went back to see this patient. This was one of the more serious ones. This gentleman, we could tell through the translator, he was sweating all over. He was diaphoretic. He was confused. We figured out through the interpreter that he had diabetes. And you all know that one possibility could be just has low blood sugar, and that can cause those symptoms. And that's fairly straightforward and easy to fix. But you also know that people with diabetes sometimes don't feel pain the way people without diabetes feel. He could be having a heart attack, for all we know, presenting with this diaphoresis. You really couldn't tell. So we couldn't handle it on the plane. He had to leave. Unfortunately, I heard he did fine, but that was that patient. Now, who was right behind me? Who had run down the aisle? My father. And you may say, your father's a pediatrician. He doesn't take care of adult patients. Your father's retired. He's no longer a doctor. No. My father has been and always will be a doctor. This is a lifetime calling. You're a doctor forever. Today's your first day. Welcome to your field of dreams. Thank you. I think at this time I'll be introducing the class president, Tim Bird. There may be an alarm about to go off in a few minutes, so if you hear that, it'll just be for a few seconds. You know, class presidents are the leaders chosen by you all as students to lead your class and work with us in administration. And the class presidents are always good people, but Tim has excelled, and especially during this trying time, he's kept y'all calm, he's kept y'all informed, he's been the voice of reason. He's been as amazing a class president as we've ever had in this College of Medicine, so I'm proud to introduce Tim to give his remarks.
Thank you, Dr. Griffith. Before I begin my remarks, I would like to induct the honorary class members for the University of Kentucky College of Medicine graduating class of 2020. These individuals were chosen for their dedication to medical student education and to student wellness. To start off is Dr. Christopher Feddock. He is the former Senior Associate Dean for Medical Student Education. Dr. Feddock has been our lifesaver over the last 4 years. He is an excellent educator who took hard material and made it digestible. His passion for education has catapulted him to a new position as the Executive Director of the Clinical Skills Evaluation Collaboration for the National Board of Medical Examiners. In other words, he is now in charge of the really expensive test that we all traveled to take between 3rd and 4th year. Just so you know how much Dr. Feddock worked and put into this institution, his position is being divided into 3 new positions. What a boss. Congratulations, Dr. Christopher Feddock, on becoming an honorary member of the graduating class of 2020. Our second honorary member is Ashley Hamilton. She is an officer in the Office of Student Affairs here in Lexington at the University of Kentucky College of Medicine. She is our point person for any question thinkable. She is known as the woman who gets things done. She has a contagious personality, always lighting up any room she walks into. She loves to hide goodies in random lockers in the student lounge. She showed up for every exam we had and was our constant cheerleader. We love her as much as she loves us. Congratulations, Ashley Hamilton. Our third honorary class member is Bodie Stevens. I don't know Bodie Stevens personally. He was voted by the students on the Moorhead campus to be their honorary RPLP class member. He is the regional project manager for the Rural Physicians Leadership Program, RPLP, and was voted an honorary member of the graduating class of 2020 by the students on that campus. Students on that campus describe Bodie as the point of contact for any question a student can think of. He helps with coordinating courses, schedules, and all events. They said he pretty much does everything. Congratulations, Bodie Stevens. Dr. Newman, Dean DePaula, and Senior Associate Dean Griffith, all other deans, faculty, and staff, family, graduates, and all others at home watching this ceremony, either pantless or showeredless, it is with great honor that I welcome you today to the commencement ceremony of the University of Kentucky College of Medicine graduating class of 2020. We have worked hard for and looked forward to this momentous occasion for 4 years. Over those 4 years, we have learned that medicine is a team sport. And so I would be remiss to stand here today without acknowledging our teammates, those who have supported us along our path to becoming physicians. On behalf of my class, I want to thank each person in the UK community that has helped us come to this point in our lives where we have the opportunity to graduate, thankfully taking a break on our couches after 4 rigorous years of preparation. To our administration and deans, you have paved the way for each and every student here at UK to have the best experience possible. To Dr. Feddock, who recently left us for USimile Step 2 CS, I sing your praises day and night. I know that at least half of my classmates belong to the Church of Feddock, and the other half are ripe for converting. I don't know how many faculty are plugged in today, but thank you for constantly presenting our class with content that has challenged our minds. I do know that Dr. Moorhead is watching somewhere. So shout out to that silver fox that always kept us on our toes. I truly believe that there is no other medical school where faculty are as passionate about teaching and love medical students as much as you. Our successes have been your successes. To our cheerleaders in student affairs, thank you. Dr. Holine, Dr. Seelbach, we appreciate you not giving up on us, even when we were giant pains in the, well, you know. To Ashley Hamilton, Thank you for providing donuts, bagels, a giant smile, and a good morning before exams. We love you and are excited to meet your new baby, Victoria, in just a few weeks. Although recently retired, I can't forget Miss Julie McDaniel. I hope you are watching somewhere. Thank you for making me feel comfortable taking out $200,000 in student loans. You have successfully made it possible for the single largest YouTube gathering of student debt in history. You have made successfully it possible for all of this. To the other staff in student affairs, thank you for your tireless work to make this medical school run smoothly and efficiently. Finally, to our parents and family, you have stood by our side, constantly encouraging us, pushing us to the very best version of ourselves. To all watching today, we are not just here to celebrate the graduates of the University of Kentucky College of Medicine Class of 2020, but to celebrate you. It is because of you that we are here today. It is because of you that our patients in pain will find relief. It is because of you that the sick will be healed. It is because of you that the poor will have a voice. Over the last 4 years, I have watched in awe my classmates serve selflessly those around them. It is because of you, 130 of the most hardworking, compassionate physicians are entering the fight to better the lives around them. It is because of you. The University of Kentucky College of Medicine has left each of us with a collection of wonderful memories. Do you all remember your interview day? Sitting in a room of highly qualified individuals, each with a perfect set of grades and high test scores. I was interviewed by Arthur Lieber, the 93-year-old radiologist, still practicing at UK today. Luckily, Dr. Lieber helped me deceive the admissions committee, and so I was accepted. Mackenzie and Caleb, both student members of the admissions committee, have made sure that no such mistake was ever made again. Do you remember orientation? I was quite excited to hear that we were the guinea pigs for a new curriculum that UK had developed. That excitement turned to rebellion after 11 straight weeks of Monday exams immediately followed by lectures, with no weekends off during our foundations course. I know the third years are still singing praises to Millie Horn for vetoing the renewal of that idea on curriculum committee in the following year. During our first 2 years of medical school, we spent hours preparing for multiple choice tests and OSCE exams. Some of us never left the basement of the library. With limited time to date, I watched several of my classmates count a Starbucks run as a date. If you ask Doug when their first date was, and then ask Sarah, you might get different answers. I think Doug considers the Starbucks run a date. Weston, I'm sorry for COVID, that it got in the way of your perfect match day proposal to Lauren. I did some major Facebook stalking for that proposal PowerPoint. I can still post it if you want. Our last 2 years of schooling were spent on clinicals and acting internships. We held retractors for 5 hours on surgery. And if you think that is bad, imagine 6 hours on medicine rounds. We had full days in the hospital and were still expected to come home each evening and study for our shelf exams. Obviously, our work paid off. We have a record number of students who matched into very competitive specialties at very competitive programs. Now, it might sound like all we did was cloister ourselves in the hospital, but that is certainly not true. Luckily, we had 2 phenomenal social chairs, Courtney Hamilton and Zach Jost. We gathered for races at Keeneland each year, trick-or-treated in the pediatric hospital, and ice skated at Triangle Park for Christmas. Without Nick Purr, we'd have no indoor soccer team and cool jerseys to wear. We traveled across the world on medical missions or study abroads. If you need to speak 5 languages, call Anita, call Candace. They have somehow mastered the art of language learning. I remember competing in a wilderness medicine competition with Ashley Flam and Caitlin Snyder in Appalachia. I'm not going to lie, the best part of that, for me, were obviously the biscuits and gravy. They were so much better than the cafeterias and way cheaper. We cheered on our favorite teams at class Super Bowl parties. Want to see the most epic collection of Patriot paraphernalia? I have Tenley's number for you. It is a Tom Brady shrine in her apartment. We gambled away our loan money each year to raise funds for our Connor and Mark Rand student clinic. Luke and Jess got us involved in the local soup kitchen and community garden. We have advocated for our patients on the state and national level. We have learned how to advocate for ourselves from classmates like Caroline, who spent medical school advocating for women in medicine, or from Ochuko, who spent his spare time advocating for minorities and visiting high schools to inspire others to follow the physician's path. I wish I could go on and on about every one of my classmates' experiences, but I would be up here all day. These experiences that we have gathered during our time in medical school have shaped us into who we are today. And it is from these experiences that we will better understand others and better treat them. Before I close, I want to share some final thoughts. A physician has many tools to successfully make a diagnosis and come up with the best treatment plan possible. Let's go through some of them. A thermometer. It measures a patient's temperature, cluing the doctor in to an active infection. Stethoscopes. These are handy acoustic devices that let us hear the sounds of the heart, the lung, the abdomen. Ophthalmoscopes stare into the eye, keying us in to processes that could be happening in the brain. Blood pressure cuffs help in the diagnosis of conditions such as hypertension. Reflex hammers. Test, deep tendon reflexes, in order to detect abnormalities in the peripheral and central nervous system. All of these tools are useful. All of them are needed. But we need a few more additional tools in our lab coat pockets. We need a thermometer that measures our own health. How can we treat others effectively when we ourselves are infected with feelings of worthlessness and depression? Each of us have had these feelings in medical school. We need to take charge of our health. We need to exercise. Look at some of the exercise gurus in our class. They all seem happy. Paul, Maria, Mark, Taylor. I don't know happier individuals. We need to eat right. Our diet not only helps us maintain a healthy weight, and yes, I'm going to shout out to Sarah Cash, who lost nearly 100 pounds since starting medical school, but it helps invigorate the mind, reduce stress, and ward off disease. We need to spend our valuable free time with our families. I've watched Victor, Leonard, and Lewis, all excellent fathers, find their greatest joy from simply playing with their adorable kids. We need a stethoscope that doesn't just listen to the heart, but listens to our patients. Each of them has a story to tell. In addition to our stethoscope, we need that ophthalmoscope, not the kind that looks to the back of the eyeball, but the ophthalmoscope that sees the individual as an individual and not as a paycheck. We must strive to be the most compassionate, understanding of physicians. The more we listen, the more we see our patients, the more we will be able to step into their shoes and treat them. We need that home blood pressure cuff used daily, not to measure our blood pressure, but our level of knowledge. We must strive to stay informed, like our attendings here at the University of Kentucky. Read, read, read. Read books, read journals. If we expect to progress, stay current, and offer the best treatments, we need to know what the best treatments are. Finally, we need the reflex hammer to test our instincts and what we have learned. This is the next phase in our medical path. These reflexes are about to be formed during residency and with experiences. Don't shy away from hard patients. Don't shy away from volunteering for procedures. They will make your reflex better and stronger. And when a patient comes to you, you will use that reflex to diagnose them. I'm incredibly blessed by all of you, my classmates. You are my closest friends. You do not even know the impact that you have had on my life. I have cherished every memory I have made with you. I have gotten to know each and every single one of you. I am excited to watch each of you learn and grow over your path during residency and over your career. Congrats, class of 2020.
You can see how excellent of a president he was. We have a couple of awards that we give out at graduation. These are some of the highest awards for the medical school. The first one we presented by a video. It's presented by Kyle Rosenstein. It's called the Clausen Award. Dean K. Clausen was one of our most illustrious deans in the College of Medicine. His grandson, Kyle, was also a medical student here and has been a resident. Some of y'all have worked with Kyle, so we'll let Kyle speak.
Good afternoon. My name's Kyle Rosenstein, and I'm the Internal Medicine Chief Resident here at the University of Kentucky. It's an honor today to present the Clausen Award. First, I'd like to start by congratulating all of you for the 4 years of hard work that you've put in, and it's been an honor to watch you all grow over the past 4 years, some of which I've been able to work with on a regular basis, and others that I haven't. I'm sure that you'll do great work moving forward. The Clausen Award is given in honor of Dr. David K. Clausen, who served as our dean here at the University of Kentucky before serving as the chancellor at Kansas University. He was a tremendous orthopedic surgeon who developed many groundbreaking techniques that are still used today. And while he was passionate about his career in orthopedic surgery, he was more passionate about helping students to achieve to be their greatest self. The award is given to a recipient who demonstrates academic excellence in the classroom and on wards, who's given back to the community, and who's helped to move the university forward. This year's recipient has been at the top of her class for all 4 years, has served the community by working at the Salvation Army, and has been an integral member of the Northern Kentucky University Admissions Committee. It is an honor and a privilege to be able to present Dr. Sarah Bowden with this year's Clausen Award, and I wish her the best of luck as she moves to the field of anesthesia at Brigham's and Women's Hospital in Boston, Massachusetts next year.
Award is the Alpha Omega Alpha Award. Alpha Omega Alpha is the National Medical Honor Society. And this is an award selected by you all as students as a class for your fellow student you feel embodies the credo of Alpha Omega Alpha. The credo of Alpha Omega Alpha is be worthy to serve the suffering. Be worthy to serve the suffering. And the person you chose that you feel emulates that credo the most is Megan Single. Congratulations, Megan. Dean DePaula will come to the podium now.
Thank you, Dr. Griffith, and congratulations, Drs. Bowden and Single, on your outstanding recognitions. Now the moment our graduates have been waiting for the last 4 years. Under normal circumstances, we would welcome each of you up on the stage with hooding, but today we have prepared this video to acknowledge each individual.
Jessica Gail Adkins from Lexington, Kentucky. Dr. Adkins will enter a residency in emergency medicine at the University of Kentucky Medical Center in Lexington, Kentucky. Dr. Adkins received the Community Service Award from the Office of Student Affairs. John Alcorn from Moorhead, Kentucky. Dr. Alcorn will enter a residency in internal medicine primary care at the University of Kentucky Medical Center in Lexington, Kentucky. Maria Alcasova from Lexington, Kentucky. Dr. Alcasova will enter a residency in neurology at the Cleveland Clinic Foundation in Cleveland, Ohio. Dr. Alcasova received a Merck Manual for Excellence in Medical Education from the Office of Student Affairs. Matthew Anderson from Tompkinsville, Kentucky. Dr. Anderson will enter a residency in plastic surgery at the Carilion Clinic Virginia Tech Carilion School of Medicine in Roanoke, Virginia. Rahul Vinay Anabathula from Harold, Kentucky. Dr. Anabathula will enter a residency in internal medicine at the Wake Forest Baptist Medical Center in Winston-Salem, North Carolina. Connor Lee Appleman from Maysville, Kentucky. Dr. Appleman will enter a residency in pediatrics at the Penn State Hershey Medical Center in Hershey, Pennsylvania. Dr. Appleman received the Community Service Award from the Office of Student Affairs. Heston Collier Arnold from Quality, Kentucky. Dr. Arnold will enter a residency in neurology at the Vanderbilt University Medical Center in Nashville, Tennessee. Elise Marie Barker from Somerset, Kentucky. Dr. Barker will enter a residency in medicine preliminary at the University of Kentucky Medical Center in Lexington, Kentucky. Wesley Barnett from Cynthiana, Kentucky. Dr. Barnett will enter a residency in emergency medicine at the University of Kentucky Medical Center in Lexington, Kentucky. Dr. Barnett received the Carey Cup Excellence Award from the Department of Emergency Medicine. Molly Carol Bates from Pikeville, Kentucky. Dr. Bates will enter a residency in neurology at the University of Kentucky Medical Center in Lexington, Kentucky. Dr. Bates received the Gerald V. Klim Award from the Department of Physical Medicine and Rehabilitation.
David E. Beeman from Crestwood, Kentucky. Dr. Beeman will enter a residency in psychiatry at the Florida Atlantic Schmidt College of Medicine in Boca Raton, Florida. Dr. Beeman received the Myron G. Standiford Jr. Award from the Department of Psychiatry. Timothy Berg from Spring, Texas. Dr. Berg will enter a residency in general surgery at the Jewish Hospital in Cincinnati, Ohio. Ayarik Bezkor from Lexington, Kentucky. Dr. Bezkor will enter a transitional year at the University of Kentucky Medical Center Bowling Green in Bowling Green, Kentucky, followed by a residency in diagnostic radiology at the University of Alabama Medical Center in Birmingham, Alabama. Elizabeth Caroline Bittner from Cincinnati, Ohio. Dr. Bittner will enter a residency in surgery preliminary at the University of Kentucky Medical Center in Lexington, Kentucky. Caroline Mitchell Blake from Lexington, Kentucky. Dr. Blake will enter a residency in internal medicine at the University of Cincinnati Medical Center in Cincinnati, Ohio. Bradley C. Blankenship from Scottsville, Kentucky. Dr. Blankenship will enter a residency in emergency medicine at the University of Kentucky Medical Center in Lexington, Kentucky. Sarah Ashley Bowden from California, Kentucky. Dr. Bowden will enter a residency in anesthesiology at the Brigham and Women's Hospital in Boston, Massachusetts. Dr. Bowden received the D. Clay Clausen Award from the Office of Student Affairs. Dr. Bowden also received the American Medical Women's Association Award. Megan Bernice Bosley from Paoli, Indiana. Dr. Bosley will enter a residency in internal medicine at the University of Illinois College of Medicine at Peoria in Peoria, Illinois. Abigail Elise Bray from Lexington, Kentucky. Dr. Bray will enter a residency in obstetrics gynecology at the Wake Forest Baptist Medical Center in Winston-Salem, North Carolina. Emily Lisa Brecky from Lexington, Kentucky. Dr. Brecky will enter a residency in obstetrics gynecology at the University of Kansas School of Medicine in Kansas City, Kansas.
Anthony Bordeaux from Brattleboro, Vermont. Dr. Bordeaux will enter a residency in family medicine at the University of Buffalo School of Medicine in Buffalo, New York. Josiah Burrows From Moorhead, Kentucky, Dr. Burrows will enter a residency in emergency medicine at the University of Kentucky Medical Center in Lexington, Kentucky. Dr. Burrows received the Stephen A. Haste Academic Performance Award from the Department of Internal Medicine. Abigail Healy Clark, from Weston, Massachusetts. Dr. Clark will enter a residency in surgery preliminary at the University of Kentucky Medical Center in Lexington, Kentucky. Courtney May Collins, from Ann Arbor, Michigan. Dr. Collins will enter a residency in general surgery at the Ohio State University Medical Center in Columbus, Ohio. Lauren M. Crossman, from Edgewood, Kentucky. Dr. Crossman will enter a residency in internal medicine at the Emory University School of Medicine in Atlanta, Georgia. Dr. Crossman received the Scholarship in Humanism Award from the Department of Internal Medicine. Jessica Crump, from Hopkinsville, Kentucky. Dr. Crump will enter a residency in psychiatry at the University of Louisville School of Medicine in Louisville, Kentucky. Paran Davari, from Tehran, Iran. Dr. Davari will enter a preliminary year in medicine at the Alameda Health System Highland Hospital in Oakland, California, followed by a residency in diagnostic radiology at the University of California, San Francisco in San Francisco, California. Logan D. Hoff, from Russell, Kentucky. Dr. D. Hoff will enter a preliminary year in medicine at the University of Cincinnati Medical Center in Cincinnati, Ohio, followed by a residency in ophthalmology at the University of Cincinnati Medical Center in Cincinnati, Ohio. Makias Desta, from Addis Ababa, Ethiopia. Dr. Desta will enter a residency in internal medicine at the New York Presbyterian Hospital Weill Cornell Medical Center in New York, New York. Ochuko P. Diamrayan, from San Bernardino, California. Dr. Diamrayan will enter a residency in child neurology at the Loma Linda University in Loma Linda, California.
Weston Dicken, from Campbellsville, Kentucky. Dr. Dicken will enter a residency in internal medicine at the Emory University School of Medicine in Atlanta, Georgia. Kayla M. Dobson, from Albuquerque, New Mexico. Dr. Dobson will enter a residency in obstetrics gynecology at the Albert Einstein Medical Center in Philadelphia, Pennsylvania. Brooke Lachey Duke, from Brownsville, Kentucky. Dr. Duke will enter a residency in internal medicine at the University of Kentucky Medical Center in Lexington, Kentucky. Dr. Duke received the American Medical Women's Association Award. Jacob S. Edmison, from Greenville, Kentucky. Dr. Edmison will complete a research year prior to entering residency. Ashley Ann Flam, from Lexington, Kentucky. Dr. Flam will enter a residency in emergency medicine at the West Virginia University School of Medicine in Morgantown, West Virginia. Caleb Flieger, from Richmond, Kentucky. Dr. Flieger will enter a residency in general surgery at the Tulane University School of Medicine in New Orleans, Louisiana. Nicholas Harding Fowler, from Bethesda, Maryland. Dr. Fowler will complete a research year on retinal imaging and genetics in the Department of Ophthalmology at the University of Kentucky Medical Center in Lexington, Kentucky. Mitchell B. Jiggendent, from Clarksville, Tennessee. Dr. Jiggendent will enter a residency in internal medicine at the Wake Forest Baptist Medical Center in Winston-Salem, North Carolina. Trent Lewis Gooden, from Versailles, Kentucky. Dr. Gooden will enter a residency in medicine pediatrics at the Vanderbilt University Medical Center in Nashville, Tennessee. Dr. Gooden received the Merck Manual for Excellence in Medical Education Award from the Office of Student Affairs. Charles G. Grigsby, from Lexington, Kentucky. Dr. Grigsby will enter a residency in medicine pediatrics at the University of Kentucky Medical Center in Lexington, Kentucky.
Olivia Grothaus, from Fort Thomas, Kentucky. Dr. Grothaus will enter a residency in orthopedic surgery at the University of Utah Health in Salt Lake City, Utah. Dr. Grothaus received the Polito Award from the Department of Surgery. Jacob D. Hambrick, from Atlanta, Georgia. Dr. Hambrick will enter a transitional year at the Tripler Army Medical Center in Honolulu, Hawaii. Courtney M. Hamilton, from Owensboro, Kentucky. Dr. Hamilton will enter a residency in psychiatry at the University of North Carolina Hospitals in Chapel Hill, North Carolina. Jonathan William Hanshu from Lexington, Kentucky. Dr. Hanshu will enter a residency in neurology at the Cleveland Clinic Foundation in Cleveland, Ohio. Nathaniel S. Hansen from Hendersonville, Tennessee. Dr. Hansen will enter a residency in emergency medicine at the University of Texas Southwestern Medical School in Dallas, Texas. Madison Priest Hardesty from Owensboro, Kentucky. Dr. Hardesty will enter a residency in internal medicine primary care at the University of Kentucky Medical Center in Lexington, Kentucky. Dwight Douglas Harris II from Manchester, Kentucky. Dr. Harris will enter a residency in general surgery at the Beth Israel Deaconess Medical Center in Boston, Massachusetts. Christopher Harriman from Louisville, Kentucky. Dr. Harriman will enter a residency in otolaryngology at the University of Virginia in Charlottesville, Virginia. Faiza Hassan from Lexington, Kentucky. Dr. Hassan will complete a transitional year in Salt Lake City, Utah prior to entering residency. Justin Ray Hayes from Cookeville, Tennessee. Dr. Hayes will enter a residency in family medicine at the University of Kentucky Medical Center in Lexington, Kentucky.
Matthew J. Henry from Somerset, Kentucky. Dr. Henry will enter a residency in pediatrics at the University of Florida College of Medicine, Shands Hospital in Gainesville, Florida. Jordan Hess from Warren, Oregon. Dr. Hess will enter a residency in general surgery at Wright-Patterson Medical Center in Dayton, Ohio. Dylan Gabriel Hickman from Lexington, Kentucky. Dr. Hickman will enter a residency in preliminary medicine at the Jewish Hospital in Cincinnati, Ohio, followed by a residency in diagnostic radiology at the University of Kentucky Medical Center in Lexington, Kentucky. Misty M. Hobbs from Las Vegas, Nevada. Dr. Hobbs will enter a residency in dermatology at the Mayo Clinic School of Graduate Medical Education in Jacksonville, Florida. Dr. Hobbs received the American Medical Women's Association Award. Zachary Matthew Hollins from Harlan, Kentucky. Dr. Hollins will enter a residency in emergency medicine at the University of Tennessee, St. Thomas Hospitals in Murfreesboro, Tennessee. Millicent Lee Horn from Louisville, Kentucky. Dr. Horn will enter a residency in internal medicine at the Barnes Jewish Hospital in St. Louis, Missouri. Sandy Wang from Lexington, Kentucky. Dr. Wang will enter a preliminary year in medicine at the Icahn School of Medicine, Elmhurst Hospital Center in New York, New York, followed by a residency in physical medicine and rehabilitation at the Schwab Rehabilitation Hospital in Chicago, Illinois. Jordan Thomas Highland from Cleveland, Ohio. Dr. Highland will enter a residency in internal medicine at the Ohio State University Medical Center in Columbus, Ohio. Lindsay Dawn Eisner from Pikeville, Kentucky. Dr. Eisner will enter a residency in emergency medicine at the University of Tennessee, St. Thomas Hospitals in Murfreesboro, Tennessee. Anthony Jeck from Berea, Kentucky. Dr. Jeck will enter a residency in pediatrics at the University of Kentucky Medical Center in Lexington, Kentucky.
Zachary Thomas Jost from Henderson, Kentucky. Dr. Jost will enter a residency in internal medicine at the University of Alabama Medical Center in Birmingham, Alabama. Mark P. Kai from West Branch, Michigan. Dr. Kai will enter a residency in internal medicine at the University of Maryland Medical Center in Baltimore, Maryland. Taylor Renee Kai from Corbin, Kentucky. Dr. Kai will enter a residency in internal medicine at the University of Maryland Medical Center in Baltimore, Maryland. Sarah Keshvars from Highland Heights, Kentucky. Dr. Keshvars will enter a residency in anesthesiology at the University of Kentucky Medical Center in Lexington, Kentucky. Ramya Kandavidi from Lexington, Kentucky. Dr. Kandavidi will enter a residency in emergency medicine at the Advocate Healthcare in Oak Lawn, Illinois. Victor Johannes Kremser from Cologne, Germany. Dr. Kremser will enter a residency in internal medicine at the University of Tennessee College of Medicine in Chattanooga, Tennessee. Alexander J. Crisco from Schnecksville, Pennsylvania. Dr. Crisco will enter a residency in oral and maxillofacial surgery at the University of Kentucky Medical Center in Lexington, Kentucky. Carlos K. Curia from Jeffersonville, Indiana. Dr. Curia will enter a preliminary year in medicine at the Christ Hospital in Cincinnati, Ohio, followed by a residency in diagnostic radiology at the Indiana University School of Medicine in Indianapolis, Indiana. Walter Blake Kuziak from London, Kentucky. Dr. Kuziak will enter a residency in internal medicine at the Marshall University School of Medicine in Huntington, West Virginia. Olivia Frances Lamping from Cincinnati, Ohio. Dr. Lamping will enter a residency in internal medicine at the Ohio State University Medical Center in Columbus, Ohio.
Michaela H. Lewis from Owensville, Kentucky. Dr. Lewis will enter a residency in family medicine at the University of Kentucky Medical Center, Moorhead, in Moorhead, Kentucky. Dr. Lewis received the William D. and Peggy Pratt Memorial Scholarship Award from the Department of Family Medicine. Evan B. Lynch from Pittsburgh, Pennsylvania. Dr. Lynch will enter a residency in plastic surgery integrated at the University of Kentucky Medical Center in Lexington, Kentucky. Dr. Lynch received the Francis M. Massey Excellence Award from the Department of Surgery. Gray H. McGee from Jackson, Tennessee. Dr. McGee will enter a residency in internal medicine at the Carolinas Medical Center in Charlotte, North Carolina. Nagomi Makia from Durham, North Carolina. Dr. Makia will enter a residency in pathology at the University of Virginia in Charlottesville, Virginia. Bushra Zernigar Munser from Lexington, Kentucky. Dr. Munser will enter a transitional year at the UPMC Altoona Hospital in Altoona, Pennsylvania, followed by a residency in diagnostic radiology at the Boston University Medical Center in Boston, Massachusetts. Jesse Stephen Matherly from Nicholasville, Kentucky. Dr. Matherly will enter a residency in psychiatry at the University of Kentucky Medical Center in Lexington, Kentucky. Tenley T. McKee from Quincy, Massachusetts. Dr. McKee will enter a residency in obstetrics gynecology at the University of Kentucky Medical Center in Lexington, Kentucky. Dr. McKee received the Lewis Perkins McHenry Award from the Department of Obstetrics Gynecology. Jacob S. Meese from Bardstown, Kentucky. Dr. Meese will enter a residency in medicine pediatrics at the University of Kentucky Medical Center in Lexington, Kentucky. Griff Moats from Louisville, Kentucky. Dr. Moats will enter a residency in pediatrics at the Virginia Commonwealth University Health Systems in Richmond, Virginia. Allison Kathleen Murphy from Lexington, Kentucky. Dr. Murphy will enter a residency in anesthesiology at the University of Kentucky Medical Center in Lexington, Kentucky.
Elias Ramsey Nasser from Louisville, Kentucky. Dr. Nasser will enter a transitional year at the University of Kentucky Medical Center Bowling Green in Bowling Green, Kentucky, followed by a residency in diagnostic radiology at the University of Kentucky Medical Center in Lexington, Kentucky. Dr. Nasser received the Arthur Lieber Excellence Award from the Department of Radiology. Caitlin Newton from Elizabethtown, Kentucky. Dr. Newton will enter a residency in pediatrics at the University of Louisville School of Medicine in Louisville, Kentucky. Shirley Ann Nunlist from Cincinnati, Ohio. Dr. Nunlist will enter a residency in pediatrics at the Virginia Commonwealth University Health System in Richmond, Virginia. Garrett Oberst from Louisville, Kentucky. Dr. Oberst will enter a preliminary year in medicine at the University of Kentucky Medical Center in Lexington, Kentucky, followed by a residency in ophthalmology at the University of Kentucky Medical Center in Lexington, Kentucky. Dr. Oberst received the Medical Student Government Association Award from the Office of Student Affairs. Toluwalope Itunualua Odukoya from Ashland, Kentucky. Dr. Odukoya will enter a residency in pediatrics at the University of Kentucky Medical Center in Lexington, Kentucky. Connor Scott O'Neill from Louisville, Kentucky. Dr. O'Neill will enter a residency in internal medicine primary care at the University of Kentucky Medical Center in Lexington, Kentucky. Elizabeth Ifeyaronwa Unyechi from Abuja, FCT, Nigeria. Dr. Unyechi will enter a residency in internal medicine at the University of Buffalo School of Medicine in Buffalo, New York. Emily Catherine Powell from Louisville, Kentucky. Dr. Powell will enter a residency in emergency medicine at the Vanderbilt University Medical Center in Nashville, Tennessee. Robert Luke Pekka from Folsom, California. Dr. Pekka will enter a residency in internal medicine at the Baylor College of Medicine in Houston, Texas. Dr. Pekka received the John Green Jr. Clinical Excellence Award from the Department of Obstetrics and Gynecology. Nicholas Purr from Goshen, Kentucky. Dr. Purr will enter a residency in obstetrics and gynecology at the Good Samaritan Hospital in Cincinnati, Ohio.
Samuel Jefferson Potter from Pikeville, Kentucky. Dr. Potter will enter a residency in psychiatry at the University of Kentucky Medical Center in Lexington, Kentucky. Dominic Anthony Prado from Tampa, Florida. Dr. Prado will enter a preliminary year in medicine at the Wake Forest Baptist Medical Center in Winston-Salem, North Carolina, followed by a residency in ophthalmology at the Wake Forest Baptist Medical Center in Winston-Salem, North Carolina. Aaron M. Pruitt from Somerset, Kentucky. Dr. Pruitt will enter a residency in primary care medicine at the Barnes Jewish Hospital in St. Louis, Missouri. Sarah Kudabudden from Lexington, Kentucky. Dr. Kudabudden will enter a residency in internal medicine at the University of Kentucky Medical Center in Lexington, Kentucky. Candace Roberts from Louisville, Kentucky. Dr. Roberts will enter a residency in medicine primary care at the Barnes Jewish Hospital in St. Louis, Missouri. Andrew Blake Rudnick from Letchfield, Kentucky. Dr. Rudnick will enter a residency in internal medicine at the University of Kentucky Medical Center in Lexington, Kentucky. Dr. Rudnick received the Albert B. Chandler Award from the Office of Student Affairs. Hannah Kathleen Ruggles from Lexington, Kentucky. Dr. Ruggles will enter a residency in medicine pediatrics at the Virginia Commonwealth University Health Systems in Richmond, Virginia. Erica T. Russ from Lexington, Kentucky. Dr. Russ will enter a residency in obstetrics gynecology at the Good Samaritan Hospital in Cincinnati, Ohio. Sharif Saleh from Toronto, Ontario. Dr. Saleh will enter a residency in internal medicine at the Case Western Metro Health Medical Center in Cleveland, Ohio. Dr. Saleh received the Medical Student Government Association Award from the Office of Student Affairs. Bryant Alexander Salmon from Jackson, Mississippi. Dr. Salmon will enter a residency in oral and maxillofacial surgery at the University of Kentucky Medical Center in Lexington, Kentucky.
Anita Joe Shanker from Frankfort, Kentucky. Dr. Shanker will enter a residency in internal medicine pediatrics at the University of Illinois College of Medicine in Chicago, Illinois. Dr. Shanker received the Gold Humanism in Medicine Award from the Office of Student Affairs. Matthew L. Silverman from Dayton, Ohio. Dr. Silverman will enter a residency in internal medicine at Wright-Patterson in Dayton, Ohio. Megan Page Single from Sarasota, Florida. Dr. Single will enter a residency in psychiatry at the University of Florida College of Medicine Shands Hospital in Gainesville, Florida. Dr. Single received the AOA Good Physician Award from the Office of Student Affairs. Hagan Elizabeth Smith from Burlington, Kentucky. Dr. Smith will enter a residency in obstetrics and gynecology at the Good Samaritan Hospital in Cincinnati, Ohio. Caitlin Michelle Snyder from Harrogate, Tennessee. Dr. Snyder will enter a residency in psychiatry at the Naval Medical Center Portsmouth in Portsmouth, Virginia. B. Arayo Sokan from Lexington, Kentucky. Dr. Sokan will enter a residency in internal medicine at the University of Cincinnati Medical Center in Cincinnati, Ohio. Molly Sullivan from Nolensville, Tennessee. Dr. Sullivan will enter a residency in neurology at the Vanderbilt University Medical Center in Nashville, Tennessee. Dr. Sullivan received the American Academy of Neurology Excellence Award and the David B. Clark Award from the Department of Neurology. Dr. Sullivan also received an American Medical Women's Association Award. Nicholas Payne Simons from Glendale, Arizona. Dr. Simons will enter a residency in internal medicine at the Wright State University Boonshoft School of Medicine in Dayton, Ohio. Justin S. Talwar from Louisville, Kentucky. Dr. Talwar will enter a residency in anesthesiology at the University of Kentucky Medical Center in Lexington, Kentucky. Colleen E. Taylor from Lexington, Kentucky. Dr. Taylor will enter a residency in psychiatry at the University of Kentucky Medical Center in Lexington, Kentucky.
Evan Michael Taylor from Evansville, Indiana. Dr. Taylor will enter a residency in general surgery at the Memorial Health University Medical Center in Savannah, Georgia. Luke Ryan Tibbetts from Victoria, Texas. Dr. Tibbetts will enter a residency in oral and maxillofacial surgery at the University of Kentucky Medical Center in Lexington, Kentucky. David Shannon Graham Turner from Rhineyville, Kentucky. Dr. Turner will enter a preliminary year in medicine at the Jewish Hospital in Cincinnati, Ohio, followed by a residency in diagnostic radiology at the University of Kentucky Medical Center in Lexington, Kentucky. Paras Kishore Vora from Owensboro, Kentucky. Dr. Vora will enter a preliminary year in medicine at the University of Kentucky Medical Center in Lexington, Kentucky, followed by a residency in ophthalmology at the University of Kentucky Medical Center in Lexington, Kentucky. Damon Wallace from Belfry, Kentucky. Dr. Wallace will enter a residency in anesthesiology at the University of North Carolina Hospitals in Chapel Hill, North Carolina. Dr. Wallace received the Peter P. Bosworth Excellence Award from the Department of Anesthesiology. Hasanki Madara Warnakula from Lexington, Kentucky. Dr. Warnakula will enter a residency in medicine pediatrics at the University of Illinois College of Medicine at Peoria in Peoria, Illinois. Yuen Wen from Lexington, Kentucky. Dr. Wen will enter a postdoctoral fellowship year with the Center for Muscle Biology at the University of Kentucky Medical Center in Lexington, Kentucky. Ashley Brooke Wicker from Louisville, Kentucky. Dr. Wicker will enter a residency in anesthesiology at the University of North Carolina Hospital in Chapel Hill, North Carolina. Elizabeth A. Willis from Scottsdale, Arizona. Dr. Willis will enter a residency in internal medicine at Wright-Patterson Medical Center in Dayton, Ohio. Robert F. Wilson from Russell, Kentucky. Dr. Wilson will enter a residency in psychiatry at the Zucker School of Medicine, Northwell Mather Hospital in Port Jefferson, New York.
Lewis Allen Winder from Asheville, North Carolina. Dr. Winder will enter a residency in internal medicine pediatrics at the Detroit Medical Center in Detroit, Michigan. William Savage Witt from Lexington, Kentucky. Dr. Witt will enter a residency in general surgery at the University of Kentucky Medical Center in Lexington, Kentucky. Mackenzie Lon Alexandra Wyatt from Mount Sterling, Kentucky. Dr. Wyatt will enter a residency in pediatrics at the Vanderbilt University Medical Center in Nashville, Tennessee. Dr. Wyatt received the John H. Githens Award for Excellence in Pediatrics from the Department of Pediatrics. Daniel J. Yaxon from Lexington, Kentucky. Dr. Yaxon will enter a residency in general surgery at the University of Kentucky Medical Center in Lexington, Kentucky. Fatima Yadudu from Kano, Nigeria. Dr. Yadudu will enter a residency in obstetrics and gynecology at the Indiana University School of Medicine in Indianapolis, Indiana. Paul Yeager from Alexandria, Minnesota. Dr. Yeager will enter a residency in diagnostic radiology at Brookwood Baptist Health in Birmingham, Alabama. Dr. Yeager received a Merck Manual for Excellence in Medical Education from the Office of Student Affairs. Leonard N. Yengwangfai from Bamenda, Cameroon. Dr. Yengwangfai will enter a residency in pathology at the University of Kentucky Medical Center in Lexington, Kentucky. Clark Yu from China, Shandong Province. Dr. Yu will enter a preliminary year in surgery at the Cleveland Clinic, Florida, in Weston, Florida, followed by a residency in interventional radiology at the University of Chicago Medical Center in Chicago, Illinois. Dr. Yu received the De Beer Medical Student Research Award from the Office of Student Affairs. Josiah Ethan Zachary from Slaughters, Kentucky. Dr. Zachary will enter a residency in family medicine at the Deaconess Hospital in Evansville, Indiana. Xingchu Zhao from Auckland, New Zealand. Dr. Zhao will enter a residency in emergency medicine at the University of Kentucky Medical Center in Lexington, Kentucky. Shelley Zappe from Johns Creek, Georgia. Dr. Zappe will enter a residency in obstetrics and gynecology at the New Hanover Regional Medical Center in Wilmington, North Carolina. Dr. Zappe received an American Medical Women's Association award.
This not only certifies that you are a physician, but it also clarifies that you will always be part of the University of Kentucky College of Medicine family, and we will always be here for you. I'm going to actually, it's not on the script here, but ask wherever you are, if you can, for all of our new physicians, please stand up so that we could all congratulate you. It is with absolute sincerity that I officially and we officially welcome you to the medical profession. Congratulations, class of 2020. You've earned it. If you're standing, I'm going to ask, and you can stand, I'm going to ask you to remain standing. Class of 2020, we now invite you to join along in the reading of the oath. Members of your class have submitted videos while reading the oath, which we will hope will have an everlasting memory and something unique for just your class. So let's do this together and watch the video.
At the time of being admitted as a member of the medical profession, I solemnly pledge myself to consecrate my life to the service of humanity.
I will give to my teachers the respect and gratitude which is their due.
I will practice my profession with conscience and dignity.
The health of my patients will be my first consideration.
I will respect the secrets which are confided in me.
I will maintain by all means in my power the honor and the noble traditions of the medical profession.
My colleagues will be my family.
I will not permit consideration of religion, nationality, race, party politics, or social standing to intervene between my duty and my patient.
I will maintain the utmost respect for human life, even under threat. I will not use my medical knowledge contrary to the laws of humanity.
I make these promises solemnly, freely, and upon my honor.
I make these promises solemnly, freely, and upon my honor.
Solemnly, freely, and upon my honor.
Upon my honor.
And upon my honor.
And upon my honor. And upon my honor.
And upon my honor.
And upon my honor.
I make these promises solemnly, freely, and upon my honor.
We believe that if we take care of you while you're here, we won't have to worry about you as our alumni. We know that our alumni will be there when we need them. And obviously in the future, as we get older, we're going to need you. That has certainly been true of our alumni, and we are pleased at this time to introduce our video message from Dr. Deborah Sal from the University of Kentucky Medical Alumni Association. Dr. Sal.
Hi, my name is Dr. Deborah Sal, and I'm the president of the University of Kentucky Medical Alumni Association. I'm a pediatrician in Bowling Green, Kentucky, where I've been since I graduated from UK in 1982. I'm so happy to congratulate you on your graduation. I know the last few months have not been easy for you. They haven't been easy for any of us. But I do want you to remember that you've probably learned so much in the last 3 months of living through this pandemic. And hopefully, at some point, you'll realize that that knowledge that you've gained is maybe worth that pain that you've gone through for the last few weeks. Once again, I'm very happy to congratulate you on your graduation, and I'd like to welcome you as the newest members of our Alumni Association. Go Cats!
To each of you moving into this next phase of your careers, nothing can change the current situation and the impact it has had on the traditional ceremonies. But no matter the circumstance, we are all proud of your achievements, and we cannot wait to see where you will all go in the future and follow your careers. Just to make a bit of a statement and a quote related to the confidence you should have in the education that you've had here as you make decisions and carve your path along the way. A quote from a famous author, Theodore Geisel: "You have brains in your head, you have feet in your shoes, you can steer yourself in any direction you choose. You're on your own, and you know what you know, and you are the one who'll decide where to go." I guess since you had a Spider-Man quote, we'd also give you a quote that was from Dr. Seuss, if you didn't know. As you leave us, remember that you are part of us. You are part of the University of Kentucky College of Medicine, and we'll always be there for you. To end our virtual ceremony, I want to share with you a special video from a distinguished Kentuckian. The message was sent just for you, the University of Kentucky College of Medicine class of 2020.
Hello, University of Kentucky graduating class of 2020. I stand here today to congratulate you on this incredible accomplishment. Not only for your academic accomplishments, but the personal sacrifices you've had to make during this unprecedented time. Unlike students before you, today you're entering the world and the workforce during a global pandemic. The coronavirus has forced you to adapt during this final year, leaving your friends and your teachers in an effort to keep those around you safe. And you did it. Today, we aren't just praising you for your academic achievements, we're praising you for your choices and actions which help save lives. I'm so proud of you. I know each of you have a bright future ahead. Congratulations to the class of 2020. Good luck to you in the adventures ahead, and go Cats!
I don't know if you realize how impressive that was, that our governor was here with you to celebrate as well. Thank you all for joining us today, you and all your families and friends. We thank you, class of 2020, for all your hard work. And again, congratulations, all you new physicians. You deserved it. Congratulations.